Hi, Hannah.
Hi.
Thanks for coming in.
Of course.
I'm so happy that you were able to come on time. We're going to go ahead and start with an exam. But before we do that, I will just need a little bit of history from you, okay?
Okay.
Go ahead and tell me first your symptoms and where is the pain located?
So I have two main problems. I have a lot of tightness in my shoulders that also affects my neck, and I feel like I need to constantly crack my neck to release the pressure. And then I'm also having some problems in my mid-back where when I'm sitting for too long, it starts to feel painful, like a sharp pain up and down.
Okay, so we might be dealing with some sciatica there. And then a frozen shoulder. Sometimes that's very common to feel that.
My shoulders are very tight.
Okay.
Painful.
Any car accidents?
No.
Head injuries?
Mm-mm.
Do you suffer from any allergies?
Just seasonal.
Okay. Are you taking medications on a daily basis?
I'm not.
Okay. Do you have any medical history?
Nothing major, no surgeries, just a few longer-term illnesses. I had mononucleosis when I was around 25. It lasted quite some time.
Okay. And have you noticed any limited range of motion with your arms or shoulders?
I do have some range of motion, especially on the right side of my shoulder. It's a little harder for me to do this internal rotation.
Okay. So let's go ahead and first take a look and see what's going on. I'm going to do a quick exam to assess your range of motion and how mobility is being affected. I'm going to check your reflexes first. Go ahead and relax your jaw for me. Good. I'm going to go on shoulders. Okay. Relax your elbow. Good. Okay, we're going to check it on the other side. Good. Okay, let's go ahead and check your patellar. Good. Good. Go ahead and tell me when you don't feel the vibration anymore.
No. 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 No.
I'm going to put gloves on and I'll take a look at your neck. Okay, relax your head. Checking cervical region. Moving to see if there is any inflammation. checking supplemental lymph nodes. Moving up to the occipital region. I'm not feeling any nodules. So we're trying to figure out where the attention originates. I'm definitely feeling very little movement in C1 and C2. Is it okay if I lower the gown a little bit? So we're going to take a look at the shoulders. I'm already noticing a little bit of a dip here. Could be caused by inflammation from the right side, trying to compensate. There are no signs of lymphadenopathy. Checking to see if there's any tension in the trapezius muscles.
It's a little tender.
I'm noticing a change in temperature too from left to right and a slight angle increase on the right side. Okay. I'm going to start with an anti-inflammatory oil. This is going to feel kind of warm. It's supposed to increase circulation. Okay, I'm gonna feel my knuckles kind of penetrating the soft tissue. We're trying to loosen up these fibers. This helps to bring toxins closer to the surface, and then they're being absorbed into the lymphatic system. This is a very gentle cupping method. It's especially used on the neck region. It's especially used on the neck region. To use cryotherapy. This feels a little bit cold since we're trying to reach the deeper level of the musculature. We're trying to unfreeze the shoulder areas. And create a very slight movement. Using a metal gua sha to move the lymph and help with drainage. I'm going to switch on the other side and repeat the same process. This oil, besides the anti-inflammatory properties, it has a magnesium base, so it does help to soothe soreness and relax the muscles. applying gentle cold therapy. This helps to bring blood flow to the shoulder region. We're trying to increase circulation into the capsule. Okay, so let's go ahead and take a look and see how the neck feels. A lot better, a lot looser. And we're gonna go ahead and do a head adjustment. I'm gonna have you relax your head, and on the count of 3, you can take a deep breath in and breathe out. 1, 2, 3. Very good. We'll do that one more time. 1, 2, 3. Very good. Okay, I'm gonna have you flip over and I'll take a look at your spine now. Okay, Hannah, I'm gonna go ahead and check the balance between the sacral and cervical region. So you're gonna feel my fingers on the lumbar part. I'm gonna press kind of harder so that we can take a feel of the deeper muscle. Okay. Go ahead and lift your right leg up. Good. Put it back down. Now go ahead and lift your left leg up. Noticing a little bit of a dip here. Go ahead and relax. All done. Checking spine mobility in this area. See if there's any correlation with the cervical part. Noticing a lot of redness around the spine, which shows lack of oxygen in this area. And slight ankle movement. Scapula is definitely locked on the left side. Just gonna go ahead and gently palpate around it, see if there's any scar tissue that has started to build up. Go ahead and relax your arm. Can I have that? So I'm gonna try to see how far you can reach. Try to touch this part right here. Okay, that's very good mobility there. Let's do the same thing on the other side. Okay. So try to touch like right here. Decreased mobility on the right side. Okay, you can relax. Okay, I do not like how the intercostal space feels. We can definitely work on the ligaments here and try to loosen them up. That's going to give you more space and increased range of motion. Okay, I'm going to take some measurements. We're looking for asymmetry. Okay, this is the highest point. 8. I think it's very important to determine if there is any temperature variation along T1 moving down to T3, and probably we're going to stop at the lumbar region. And this helps to determine if there is any imbalance. Okay, we're going to mark here. And this is where the first imbalance started. We want to make sure that we are treating those points. Slight movement at T2. Slight variation, T5. And it looks like it's starting here. It's very interesting. Okay. 1, 2, 3, 4, and 5. Perfect. I'm going to start with slight movement of the spine before we do any aggressive treatment. Okay, this is going to feel a little bit warm. It is the magnesium oil that helps the mineral to be very easily absorbed and to reach the muscles that lack this mineral. Focusing on the paraspinal muscles. To listen to your spine. I want to see if there's any microscopic movement that can be triggered by breathing or blood flow. It is very important for this test that you breathe in a non-labored way, very natural. Looking for any intercostal movement. These muscles get so tense sometimes that restrict any type of blood flow to the vertebrae. Taking in consideration that you're using your right side more than left. The focus of this treatment will be towards the most inflamed part. Very good movement there. Slight inflammation on the right side. Okay, we're going to look for any neurological deficits. So you're going to feel a little bit of tapping. This percussion helps to determine any abnormal movement in fluid. We have to make sure that we are not touching certain points when doing this. Very little movement on the right side, but that's okay. We're gonna go ahead and try to fix that today. Okay, it's gonna feel a little bit warm. I'm gonna do a little bit of cupping. This cupping is very gentle. It does help to stimulate blood flow. Focusing on the paraspinal muscles. This tool uses a very gentle suction to stimulate blood flow and bring toxins that have been accumulating in the tight muscles. Okay, moving to the left shoulder. Okay, we're going to start with a very gentle movement of the spine. This is going to feel kind of like a clickly popping sensation. This adjustment helps to stimulate blood flow and to increase the space that is supporting the vertebrae movement. This already feels a lot better. The right side is the part that needs a lot more adjustment. And fixing. A lot better. Okay. I'm going to start with a little bit of scalp movement as well. We do accumulate a lot of tension in this area. It's going to feel kind of like a scratching sensation, but it does bring a lot of blood flow. It helps to relieve migraines and tension headaches. Okay, go ahead and take a deep breath in. Breathe out. Good. Feeling a lot of movement as we're doing this, which is good. We're creating that natural space. You can feel each spinal part moving. There's a lot of natural cracking. Go ahead and take a deep breath in and breathe out. Very good. I'm going to ask you to lift your legs up, 90-degree angle. Okay, and on the count of 3, go ahead and take a deep breath in and hold it. 1, 2, 3. Hold it in. Very good. Breathe out. And you can relax your legs. Okay, we're going to do a little bit of skin pulling and skin cracking. It's going to feel kind of like a pulling sensation. Okay. I'm going to apply some acupressure, focusing mainly on the points that had the temperature variation. Applying gentle pressure here. These are some pressure points that can also help with any digestive issue. You might see a little bit of redness. I'm going to apply some pressure as we're going up the trapezius line here. I'm going to apply gentle pressure on the occipitus part of the cranium. I'm going to use a little bit of hair pulling to release that pressure. Okay, Anna, we finalized today's session. I'm gonna have you stand up and you can get dressed. I'll see you in the front office. My name is Dr. Matt. I'm going to do your exam today. Can you please verify your first and last name and your date of birth?
It's Amanda Jackson, and the date of birth is 7/22/2000.
Okay, perfect. And do you have any allergies?
I'm allergic to gluten.
Gluten. Okay. You're here for a scalp examination,
Yes.
correct? Okay. Are you experiencing any itchiness?
A little bit, especially with the weather changing, it's been getting pretty bad.
And where have you noticed it more frequent?
Mostly like on the very top.
On the top. Do you experience any dandruff?
A little bit, yeah.
Okay. What kind of shampoo do you use?
I just use Amika.
Is that what you've been using for the last 3 months?
Yes.
Okay. Do you use the same conditioner?
Yes.
Okay. Do you use any serums?
No.
Okay. Are you taking vitamins?
I take melatonin at night, but no other vitamins or anything.
Okay. Okay, so you're taking melatonin at night, no multivitamin. Any medications on a daily basis?
No medications on a daily basis. I take ibuprofen sometimes, but other than that, nothing.
Okay. Occasionally. Are you experiencing frequent migraines?
I wouldn't say frequent, maybe like once or twice a month.
Do you think they're in relation to your monthly cycle?
Maybe.
Okay.
Sometimes they're a little all over the place though.
Okay. And do you experience any kind of pain or numbness around the scalp?
Sometimes pain, but no numbness.
Okay.
And nothing too crazy, just a little bit.
On a scale of 0 to 10, how would you rate that?
Like a 3.
Okay. And how would you describe your diet?
I tend to eat pretty healthy. I'm a vegetarian, so I eat a lot of fruits and vegetables too.
Okay. Perfect. And how often do you change your pillowcase?
I would say I wash it about once every week or 2.
Okay. And how often do you change the actual pillow?
Once every couple months.
Okay. Okay. We can go ahead and start the examination. I usually start this process with a pH testing. We want to make sure that your scalp is not too acidic. That definitely encourages the increase of bacteria or viruses on the scalp area. Okay, I'm just going to write here. We're going to take 3 samples. This is 1. We're going to apply solution that helps to determine the pH. First, we're testing the top part, and then we're going to take a sample from each side, right and left. Okay, so this is sample 1. Second, we're going to use the same basic solution to help determine this one is going to be on the side. I'm just going to have you turn your head towards the left. Then we have here the third sample. Go ahead and turn your head towards me now. Now that we have the third sample, we're just going to go ahead and run this to the lab and we'll determine what kind of treatment we need to do, okay? Okay, I'm now going to put gloves on and I'll dive right into the scalp exam. Now that we have your pH results, we kind of know the route we need to take. Go ahead and lift your head up. Okay. The first step is to take a look at the skin. We're going to use a magnifying glass that helps us visualize the hair follicle and see if there's any skin disorders that we need to treat. Go ahead and turn your head towards the right. I'm just going to brush this part. Good. And left. Going to take sections and we're going to visualize the skin. Gently, I'm going to be pressing down so that we can visualize the skin better. Okay, a little bit of flakiness around the root of the hair follicle. Overall, I would say that it looks pretty clean. I do notice some buildup. I can tell that you're experiencing a little bit of hair thinning. We're definitely noticing more buildup around the hair follicle as we're moving up, and some product buildup. Okay. We're looking at the health of the hair follicle. I'm not seeing any infection. Dryness. Dry patches. And some redness. A lot of build-up here as we're moving towards the part that you're experiencing more symptoms like itchiness, which can definitely explain. Okay, let's take a look right behind your neckline. Okay. Okay, base of the scalp looks a little bit worse than the front. Probably this is the part that you're not able to shampoo that well. And it's very normal. Sometimes even an imbalance in hormones can trigger dryness. It's definitely a combination of dry and oily overall on the scalp. Okay, I'm gonna move towards the top. Okay. A lot of redness. That could be a lack of oxygenation towards the scalp area. Not necessarily the brain, of course, just the skin. Okay, go ahead and turn your head towards the right. We're going to take a look on the left side. Good. Overall, I would say there is a lack of circulation in certain areas, and that can trigger for the scalp to have less oxygen. Okay. Hair follicle has even more buildup on the left lower side, so that's right behind your ear and behind the neck area. Okay. Not so much thinning of the hair, but just increased oiliness, which is normal, especially if you are on day 2 or 3 of washing. Okay, that's a lot of sebum there. Sometimes too much production of the gland oil can be detrimental. Okay. I'm going to take a picture of this. Okay, I'm going to start with the front part. I'm going to do a hairline test. I'm going to look to see if there is any inflammation. It's going to feel like a mild tapping. Go ahead and turn your head towards the right. Go ahead and tell me if you feel this cold or warm.
Cold.
What about now?
More. More. Cold. Cold. Cold.
Okay. And does this feel sharp or dull?
Dull.
Go ahead and tell me if this feels sharp or dull.
Sharp. Sharp. Sharp.
Okay. I'm going to do a vibration test. Go ahead and tell me when you don't feel the vibration anymore.
It stopped. It stopped.
Okay. Does this feel cold or warm?
Cold.
What about now?
Cold.
Does this feel cold or warm?
Cold.
How many taps do you feel this tap? 1, 2, or 3?
2. 1. 2. 3.
And does this feel sharp or dull?
Sharp. Sharp. Dull.
Okay, I was go on and check the other side. How many times do you feel this tap? 1, 2, or 3?
2, 1, 2.
And does this feel cold or warm?
Cold. Cold. Cold.
And did that feel the same on all 3 parts?
Yes.
Does this feel cold or warm?
Warm.
Warm about now?
Warm.
And now.
Warm.
Okay, I'm going to touch you with a sharp or a dull object. Tell me if this feels sharp or dull.
Dull. Sharp. Sharp. Dull. Dull. Dull.
And does this feel cold or warm?
Cold. Cold. Warm.
We're going to dive into treatment, starting with an acupressure method that helps to activate certain points on the scalp. So this is going to feel kind of like a pushing sensation. If there's any part that feels more sensitive, let me know. This will help to activate the main sensors of the scalp, and it's going to make the massage more beneficial. Going to apply a hair serum. It has ashwagandha exosomes. It will not leave the hair oily. It's going to feel a little bit cold. We did leave it at room temperature to avoid that temperature shock. Just applying a few drops that we're going to massage everywhere. It's going to help with the thinning of the hair that we noticed on this side, and also with the buildup. Going to apply this at the base of the scalp. And it helps to increase circulation towards the baby hairs that surround the scalp area. Okay, we're going to go ahead and turn on the other side. Okay, we're going to start with the same ashwagandha serum. Applying it at the roots. This is going to help with circulation. Okay, I'm going to apply a little bit of heating. This is going to get warm. It'll help with circulation. Okay, let me know if it's too hot. We're using a meridian brush. It has light energy, thermal energy, and bioelectricity. How does this feel?
Feels good.
We're using microcurrents to help with circulation. Okay, go on and turn your head up. That's good. Okay, Amanda. We were able to do a treatment today that will help with follicle regeneration. You're gonna see a little bit decreased serum production, and your hair is not going to get oily that fast. I think overall the hair and the scalp look pretty healthy. Maybe just try to minimize the product that you're using. Sometimes that can be detrimental to the scalp health. Hi, Amanda.
Hi.
It's lovely to see you again.
Good to see you too.
Thank you for coming in. We're going to do a head-to-toe examination today. Can you please go ahead and verify your last name
Johnson.
and your date of birth?
It's July 22nd, 2000.
Any new allergies?
No.
When was your last medical checkup?
About a year ago.
Okay, any surgeries in your lifetime?
In my lifetime, yes. About like 15 years ago, I had surgery on my elbow.
Okay, and how is that healing right now?
It's good.
Perfect. Which one is it? Right or
Left.
left? Was it because of an accident?
Yes.
Bike ride?
I was from a trampoline.
Are you taking any medications on a daily basis?
Not on a daily basis. I take ibuprofen when I need it, but that's the only thing.
Okay. Any vitamins?
No.
Birth control? Are you experiencing any pain anywhere in the body?
Not regularly. Sometimes my back hurts off and on, but other than that, nothing.
And any hospitalizations in the last couple of months?
Not in the last couple months, no.
Did you get the flu vaccine
Yes.
this year? Okay, perfect. So you're up to date with that. Any family history of hypertension, hyperlipidemia,
Not that I know of, no.
thyroid disorders?
No.
Okay. Anything in particular that you would like me to address today?
I've been having some issues with my skin, with like eczema and stuff like that, especially with the colder weather.
Okay, absolutely. I can take a look and see what kind of bumps I find on the body and see how we can help you today. I'm going to sanitize my hands and start with vital signs. Any flu-like symptoms in the last 2 weeks?
No.
Okay. It is the flu season, so we want to stay home when we are sick. This is gonna go on your forehead. 98.0, perfect. And we'll take your oxygenation and heart rate. Go ahead and relax your arm. Okay. This will go on your upper arm. I'm gonna take your blood pressure. Okay, go ahead and relax for me, please. Blood pressure is 118/60. It's perfect for your age. Oxygenation 98% under room air, and heart rate is 65. That's also very nice and relaxed. Okay, I'm going to listen to your heart and lungs. Go ahead and breathe normal for me. Is it okay if I put the stethoscope a little bit under the shirt? Okay, you can breathe normal. We're trying to listen to your heart. I can hear only S1 and S2. And now S3, now S4. Go ahead and take a deep breath in for me. And exhale. And again, take a deep breath in. And exhale. One more time, breathe in. And breathe out. And again, breathe in. And breathe out. Okay, you can breathe normal. Going to listen to your jugular. Go ahead and take a deep breath in and hold it in for 3 seconds. 1, 2, 3. Good. Breathe out. Hold to that one more time. Breathe in. Then hold it for 1, 2, 3. Breathe out. Okay. Very good. Okay, I'm gonna have you change into this scalp, and we're going to continue the exam after. Okay. I'm just going to put gloves on, and we're going to start first with an eye examination, and that will allow me to see exactly where your neurological nerves are doing. And also, after that, you can go ahead and relax and close your eyes. Go ahead and look right here. Okay, so we're assessing a pupil size. So looking at constriction. Okay, pupils are round and reactive to light and accommodating. There is no jaundice. Go ahead and look right here for me. And here. Okay, there's a little bit of shaking when you're looking towards the right. Go ahead and look again. Is your face blurry in here? No. Okay. Let's go ahead and check your throat and your tonsils. Give me a big ah. A little bit of redness in the back of the throat. Does it hurt when you swallow saliva or when you drink liquids?
Sometimes, not really though.
Go ahead and give me a big smile. Good, strong and symmetric. And buff your cheeks for me. Keep them buffed. Don't let me unbuff them. Okay, relax. Now go ahead and raise your eyebrows. I'm going to try to push them down. Don't let me do that. Okay, very good. Relax. Now I'm going to try to push your heads towards your right. Don't let me do that. Okay, very good. Now go ahead and on the count of 3, I'm going to ask you to shrug your shoulders. Go ahead and shrug your shoulders. Very good. Now go ahead and shrug your shoulders one more time. I'm going to check any lymph nodes that might be enlarged in this area. Okay. Go ahead and cover your right eye. And with the other one, can you hold the Snellen chart? Extend your arm all the way. Can you identify this color?
Red. Green.
Okay. What number do you see here?
9.
Can you read the last row starting with the first letter towards the right?
HPFTL.
Okay. Go ahead and switch eyes. What color do you see here?
Green.
What number do you see here?
5.
Go ahead and read the second to last row, starting with the first letter to the right.
JHDFC.
Okay. And you don't wear contacts, correct?
I do wear contacts.
You do wear contacts. Okay. So let's go ahead and take a look at your ophthalmic nerve. I'm going to have you look straight behind us. Try to keep your eyes open. No redness, no inflammation on the right side. Try not to blink. Perfect. Okay, let's go ahead and check your other eye. You can go ahead and blink now. I know it's not that easy. Okay. Okay, go ahead and look up. And now look back on the wall behind me. Okay, I'm not seeing any inflammation there. It looks very good. I'm going to go ahead and check your ears as well. Okay, go ahead and turn your head that way. I'll have you relax. Tympanic membrane is pearl gray. The canal has a little bit of earwax, but we can definitely visualize. Let's check the other side. Okay. Do the same thing on the other side. A little bit of redness, but it might be due to a little bit of debris. We can definitely try to schedule an ear cleaning and see how that goes. I'm going to check your reflexes now. Go ahead and close your eyes and relax your jaw. Open your jaw a tiny bit. Perfect. Okay, good. Okay, very good. Go ahead and relax your arm for me. I got you. Okay. Good. We're checking your reflexes. That's very good. Excellent. Let's check the other arm. Okay, let's relax the wrist. Good. Excellent. Now I'm going to have you relax your arm. I can tell that this is where the surgery was. Go ahead and relax it. Relax the shoulder. There you go. Good. Okay, good. Relax. Okay, and I'm just going to put your hair up a little bit. So now we can take a look at the skin in the back. Okay, and is it okay if I open the gown?
Yes.
Okay, I'm going to start with a visual inspection. Just a normal hormonal imbalances that could be triggered, and that's exactly what you can see. Is just a little bit of a redness that come and go with the cycle. We're looking for increased redness, raised papules, and lesions. I'll let you know if I find anything concerning. And at any moment you feel a type of discomfort, tingling sensation, or abnormal soreness, let me know. to palpate. I'm going to palpate your spine, starting with the cervical. We're looking for any nodules or abnormal pulsations. Also, assessing the normal curvature of the spine. It is normal for the spine to be curved at different points. But we're looking for signs of scoliosis, lordosis. Okay. There's a little bit of an indentation here at the lumbar area. Are you experiencing a lot of back pain, lower back pain?
Sometimes.
Okay, we're going to do a few tests here to see if you can distinguish different feelings. Go ahead and tell me if you feel this vibration or pressure.
Vibration. Vibration. Vibration.
And what about now?
Pressure. Pressure. Vibration. Vibration.
Okay, go ahead and tell me if you feel this cold or warm.
Cold. Cold. Warm. Warm. Cold. Cold. Warm. Warm. Cold. 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 Cold.
Okay. I'm going to take a few measurements. We're looking for inflammation, 48, 43. And that could be triggered by an imbalance. 45, so definitely a deviation. 26. 1.5. 39. That's 40. 17. Okay, I'm going to check for any neurological deficits. Just relax your back. Looking for normal pulsations. The nerves run through the paraspinal muscles, and when triggered, we can have a sudden movement. Just noticed one on the right side. Okay, go ahead and tell me if you feel this on the left or right of your spine.
Right. Left. left,
Sorry, let's have one more time.
left, right, right, left,
Good. Does this feel sharp or dull?
sharp, dull, sharp, 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 dull, 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 sharp, sharp.
Does this feel dull on both sides?
Yes,
Does it feel the same?
yes,
What about now?
yes.
And now?
It feels sharp.
Okay, very good. Go ahead and tell me if you feel this 2 or 1 pressure point.
2, 2,
Good.
1,
Good.
2, 1, 1.
Okay. I'm going to listen to your lungs in the back. I'm going to have you take a full deep breath in and breathe out. Good. Let's do that again. Take a deep breath in and breathe out. And again, breathe in and breathe out. And again, breathe in, breathe out. And again, breathe in, breathe out. Okay. Go ahead and tell me if you feel any kind of pain. Okay, perfect. So what I'm gonna have you do, I'll have you lean down now, and we'll take a look at your scalp first, and your face. Okay, Amanda, go ahead and relax. I'm going to start by palpating your temporomandibular joint. Also, check your lymph nodes that are preauricularly situated. We're looking for fluid buildup that could resonate to lymphatic fluid. Checking under the jaw, we have submental lymph nodes. Slowly palpating so that in case we do discover anything, we are not disrupting it. To check your sinuses, first starting with the ones in between the eyebrows. Okay. Periorbital socket looks normal. I'm not seeing any circulation problems. Eyes look symmetric as well. Eyebrows, maybe the muscles could be a little bit tense on the upper side. Okay, slowly palpating right under your eyes. This is where we have the second set of sinuses. Nose is a tiny bit asymmetric. The left nostril seems to be more inclined interiorly. Go ahead and breathe in, breathe out through your nose. Good. So we're checking patency to make sure that there is no obstruction. Breathe in, breathe out. Okay. So it's a lot better on the left side. Do that again. Good. You might be having a little bit of a deviated septum. Do you know if you snore at night?
I do not.
You do not snore?
I do not snore.
Okay. Okay, slowly I'm just going to palpate the hairline. Not feeling any lumps or bumps. Moving back towards the ears, palpating the mastoid bone. Let me know if you feel any kind of pain as I'm swiping the finger on this region that has no hair. Sometimes we could have like an absent mastoiditis, very little symptoms until it gets just worse. And we want to make sure that we're checking this part as well. Okay, I'm not noticing any earlobe lumps. Moving down to the neckline, just going to slowly palpate. The sternocleidomastoid muscle can be very tense. Palpating trachea and thyroid gland. Trachea is midline positioned. I'm not feeling any nodules on the thyroid gland. Go ahead and swallow saliva one time. Can you do that again? Good. Is it okay if I open the gown a little bit to here? So I'm going to check the neck and a little bit of the chest area. Moving back to the scalp. Just trying to see if there are any palpable lumps on the scalp region. Kind of turn your head towards your left, okay? Perfect. Relax. going to do a detailed scalp examination, which means that I'm taking a look at the skin. Scalp health is very important for hair growth. And for overall hair follicle regeneration. I'm noticing some redness consistent with sun exposure. I'm going to check for sensitivity. Go ahead and tell me if you feel this sharp or dull.
Sharp.
And now.
Sharp.
And now.
Sharp.
Okay, so the scalp is very sensitive. So I just touched you with a dull object. Go ahead and tell me if you feel this cold or warm.
Cold.
Okay. And now.
Warm.
And now.
Warm.
Okay, let's do this one more time.
Warm.
Okay.
Warm. Warm. Cold.
Okay. Scalp looks healthy. The only condition that I'm noticing is sunburn, and it is more consistent on the top part of the head. It's kind of little on the sides. Hair follicle looks normal. I'm going to do a hair pulling test to see how easy the hair breaks. And how sensitive the scalp is. I'm noticing increased redness actually, so there is a little bit of inflammation under the first layer of the skin. I would recommend an anti-inflammatory scalp analysis and treatment. Do that one more time. Okay. I you experiencing any type of itchiness?
A little bit sometimes.
Okay. And is it localized mostly on the top part, or does it spread anywhere else?
Mostly on the top.
Okay. Alright, I'm gonna go ahead and check your abdomen now. Okay, Amanda, I'm just going to slowly visualize the abdominal wall. Let me know if you feel any kind of pain as I'm doing this. We're trying to take a look at the main organs and see if there is anything that we should be concerned with. Before I palpate, I'm going to take a few measurements to see if there is any signs of inflammation. 35.6. 21.5. 30. 32.5. Okay, I'm going to go ahead and check the skin, see if there is any raised bumps. Now go ahead and tell me if you feel this vibration or pressure.
Vibration. 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 Pressure. Vibration. 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 Pressure.
Go ahead and tell me if this feels cold or warm.
Cold. Cold. Warm. Warm. Cold. 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 Warm.
Go ahead and tell me if you feel this on the left or right.
Left. Left. Right. 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 Left. Right. In the middle.
Okay. Going to slowly palpate, starting with the left quadrant. We're looking for any signs of inflammation, pulsations, checking your kidneys. Any pain as I'm palpating here?
No.
Okay. Just going to slide my hand under your belly here. Just going to palpate. Try to relax your abdomen. Okay, let's go ahead and check the other side. We'll do the same thing. Go ahead and relax. Relax. we're doing percussion to understand if there is fluid or solid in the abdominal cavity. It also helps to determine if there is an enlarged organ. I'm going to have you stand up and we're going to talk about the results. Okay, Amanda, everything looks good. I'm just going to have you come back in 2 weeks so that we can discuss the results of the x-ray. We're going to take an x-ray of the lower mid-back. I want to see if there is any shift or deviation of the lumbar spine, which could explain why you're experiencing so much pain. Do you have any questions for me before we go? Okay, perfect. I'm just going to sign this for you, and if you don't have any more questions, then I'll see you back in 2 weeks.
Awesome.
Thank you.
It's like minty or eucalyptus. That one's really sweet.
I'm going to sanitize my hands and take your vital signs. This will go on your forehead. I'm going to check your temperature, 98.2 Fahrenheit. Very good. And I'm going to put this on your index finger. Relax. Alright, we're going to take your blood pressure. This is going to go on left upper arm. I'm going to measure your blood pressure. I'm going to have you relax. Blood pressure is normal, 110/67. And heart rate 66, oxygenation 98% on room air. Okay, we're going to go ahead and continue with the exam. I'm going to have you change into this gown, and then we're going to have you lay down and we're going to begin the exam. I'm going to start with a physical touch. We're going to palpate, starting with the face. You did mention that you're having some difficulty with feeling and sensory perception around the jaw area. So we're checking for any lymph adenopathy, lumps or bumps, and for asymmetry. Sinuses are intact. Not feeling any extra fluid. Palpating the neck area. No lymph node enlargement behind the ears and in the back of the neck. Just slowly going to palpate the head and the scalp area. Mastoid bone is non-tender, not noticing any redness or swelling, no signs of mastoiditis. Going to compare with the right side. Okay, now that you're with your eyes closed, I'm going to check your olfactory nerve. So go ahead and take a deep breath in. The through your nose and tell me if you can identify the smell.
It's like minty or eucalyptus.
Good. I have here another scent.
That one smells like garlicky.
Garlicky. That's good. Oopsie. And I have here one more scent.
That smells like chamomile.
Very good. So yeah, it was herbal. And since you are here, we're going to check your taste as well. So this is a piece of paper that I'm going to put on your tongue. And I'm going to have you identify what it tastes like. This is going to go on your tongue. Go ahead and open.
Kind of tastes like citrusy.
Okay. Okay, go ahead and open and tell me what this tastes like.
Bitter, kind of like coffee grounds.
Good. Okay, and I have here one more.
That one's really sweet.
Okay. Perfect. I'm going to take some measurements. We're going to check for asymmetry to see if there is any level of inflammation. One over 15. The jugular seems to be a little bit enlarged. I'm going to go ahead and listen. Okay. Go ahead and take a deep breath in and hold it in for 1, 2, 3. Breathe out. And again, take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay. So I did hear brewy, just not on the normal side. Okay, I'm going to do a test around the neck in the jaw area. Go ahead and tell me when you don't feel this vibration anymore. So it seems like there's less nerve conduction on the left shoulder. I'm going to check your reflexes. Go ahead and relax your jaw. A little bit more. Good. Okay. Go ahead and tell me if you feel this 2 or 1 pressure point. 2. 2. 2. 2. 1. Okay, go ahead and tell me if you feel this on the left or right. Left, right, right, left, left, right, middle, left. Okay, does this feel the same as this? Yes. And does this feel the same as this? And this the same as this. Yes. Okay. Does this feel cold or warm? Cold. Cold. Warm. Warm. Cold. Warm. Cold. I'm going to take a look inside your ears. Go ahead and turn your head towards the right. This one's just going to feel a little bit cold. We're just visualizing the tympanic membrane. There are no signs of cerebrospinal fluid linkage. Okay, go ahead and turn your head towards the left. No fluid buildup. Tympanic membrane is dark gray. Margins are well defined. Okay. I'm going to listen to your heart. I'm going to slide the stethoscope under the gown. You can go ahead and breathe normal. Okay, I'm going to check for murmurs. Go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. And now take a deep breath in and then exhale. And again, breathe in and exhale. Okay. Let's go on and check your scalp. Have you noticed any itchiness or lumps around the scalp?
No itchiness or lumps, just kind of drier scalp.
Drier scalp. Okay, so let's check for any skin disorders or neurological deficits. Go ahead and tell me how many taps you feel. 1, 2, or 3.
2, 2, 2, 1.
Okay. Do you feel this 2 or 1 pressure point?
1, 1, 2, 1, 2, 1, 1, 1.
And does this feel sharp or dull?
Can you do it again? Dull,
What about now?
dull, dull, dull.
And does this feel sharp or dull? You can't really feel it, right?
No,
Okay, because I touch the scalp constantly and it doesn't seem to react. No feeling whatsoever to the dull sensation here. Okay, I'm going to take a sample to see if there is any fungal growth. I'm going to apply a basic solution. It's going to help to neutralize the skin cells that we are removing. We are going to send this to the lab. Does this feel cold or warm? Warm. What about now?
Cold.
And now?
Cold. Cold. Cold.
Go ahead and tell me if you feel this 1, 2, or 3 taps.
1, 2, 2, 3.
Do you feel this 2 or 1 pressure point?
1. 1. 1.
And does this feel sharp or dull?
Dull. Dull.
What about now?
It's dull.
But you can feel it better than
Yeah,
when we touch here.
yeah, when it's closer to my forehead.
Okay, I'm noticing a little bit of redness on the left side. It seems like it extends from top of the ear. The scalp looks healthy. A little bit of oily sebum production on that side. I'm noticing the same redness on the right side. It might explain the itchiness that you've been experiencing. Okay, we're gonna take a look at your abdomen. Okay, we're going to start with the left kidney, so I'm just going to palpate using a circular motion to see if there's any tenderness. And slowly I'm going to compare. Okay, Now that we moved things around, I'm going to listen. This is going to feel a little bit cold. I'm going to progress, starting with the left upper quadrant. I'm going to take some measurements, checking for abdominal distension. When was your last ultrasound?
I believe 3 or 4 months ago.
8.9. So I would say about 2-degree difference from left to right. Okay. Go ahead and tell me if you feel this sharp.
I do.
Do you feel that sharp all the way?
Yeah.
What about now?
Yeah. 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 Yes. Yes.
Does this feel dull or sharp?
Dull. 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 Dull.
Okay. Okay, this is gonna go on the hip bone on the left side. Can you feel that vibration?
Yeah.
Tell me when it stops.
No.
Okay. Now this is going to go on your intercostal. Can you feel that vibration? Tell me when it stops.
No.
Okay. Now we're gonna be on the right hip. Do you feel that?
Yeah.
Tell me when it stops.
No.
And right intercostal C5. Do you feel that? Tell me when it stops.
No.
Okay. Alright, let's go ahead and check your back. Okay, I'm going to palpate the cervical spine. We're looking for signs of inflammation. Just slowly trying to move the vertebrae to check the mobility. A slight curve towards the left at the last thoracic. Scapulas are midline. Paraspinal muscles are well vascularized. We're going to check hydration status. Okay, just checking some asymmetry. We want to make sure that both parts are equal. It's going to feel a little bit cold. I'm going to have you identify the shape that I'm drawing. So now I'm just applying the gel. Okay, so I'm going to draw a shape. Go ahead and tell me if you can identify it. Circle. Star. Okay, what letter am I drawing? What about now? Okay, very good. This is going to feel a little bit cold. Okay, we're going to check spinal reflexes. Any pain there?
No.
Go ahead and tell me if you feel this sharp or dull.
Dull. Dull. Dull. Dull. Sharp. 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 Dull. Sharp. Dull. Sharp. Dull. Can you do that one again? Dull. Sharp. Dull. Dull. Sharp. Dull. Dull.
Okay. Seems like there is a conductory problem here around the scapula. We can go ahead and run some more tests and see how the results come out. There's definitely a little bit more inflammation on the left side. Okay, Angelina, so everything looks good. We're just going to run some tests to make sure that everything is normal. You did have some sensitivity on the left upper side. We're going to run a chest CT. And for that, we're going to have you come sometime in the morning after you rested and you had breakfast. So the image does look normal. And otherwise, we're gonna probably take some samples as well, just to rule out anything. And we're gonna call you back with the results.
Okay,
All right, you're welcome. Thanks for coming in.